All right. Well, thank you very much,
Yeah.
Nima and Zach and everybody that helped put this together. My name's Colin Koros. I'm the Chief Commercialization Officer of Nanostics. And Nanostics is a diagnostics company. We're a spin-off of the University of Alberta. We're part of the University of Alberta Health Accelerator Program. And we're developing novel diagnostic tests. And so at Nanostics, we really focus on the detection of something called extracellular vesicles. And for those who aren't familiar, extracellular vesicles are these small vesicles which are emitted by all the cells in your body. Some of these vesicles are actively emitted and some just shed naturally. But it's a really exciting new area of biology. In the last 3 to 5 years, we've discovered that within these extracellular vesicles is a lot of information. We find proteins, DNA, RNA, and all this information is being shared between cells and between cells and tissues. And it turns out that our bodies have this sophisticated messenger system that are programmed in these extracellular vesicles. And so you can imagine all the excitement in the field of if we can begin to understand what's in these extracellular vesicles, we can begin to use them to develop new diagnostic tests. And you can take it a step further and perhaps we can begin to create our own extracellular vesicles and begin to reprogram cells. Well, at Nanostics, what we do is we look at extracellular vesicles in the blood as a diagnostic tool. And in order to do that, we use a technology called microflow cytometry. Microflow cytometry is very similar to a standard flow cytometry, which is a standard clinical instrument found in a lot of clinical labs. But microflow cytometers are able to look at these smaller particles with resolution, which couldn't be done before. And we can look at millions and millions of these particles in just a few drops of blood. And so how does our technology work? Well, essentially we take healthy patients and look at their extracellular profile using various biomarkers for particular outputs, and we compare it to diseased patients and put all this information using multiple biomarkers, millions and millions of these vesicles, and we apply machine learning technique to create a fingerprint of disease. Our first proof of concept of this was with prostate cancer. We did this process with prostate cancer and led to the development of a test that we call Clarity DX Prostate. It's 330% more accurate than any other prostate cancer test on the market. And we're currently in partnership with DynaLife Labs right now in Edmonton, developing this for the clinic. We have a lot of other tests in the pipeline, including bladder cancer, immunotherapy, and more recently COVID-19. With the COVID-19 test, where we look at our extracellular vesicles, which are being emitted by our immune cells, and we can look at severity of disease. So where are we at? So in 2017, we finished our initial prospective study, which showed the accuracy of this test. We partnered with DynaLife Laboratories, and now we're running, we've raised $3.9 million in equity and $2.6 million in non-dilutive funding to support a pivotal clinical trial. We're currently in that study right now. All those samples are being tested in DynaLife in Edmonton, and we're recruiting in Florida, Massachusetts, Edmonton, Calgary, and whatnot. In the fall here, we'll be raising a $15 million Series A to help fund the commercialization of the test and our product pipeline. We put together a really strong team, and if you have any questions, my information's on the screen, and happy to answer them.